Alright, so today we'll be starting with mucolytic expectorants. So we were discussing the respiratory pharmacology in veterinary pharmacology. So mucolytic expectorant, before moving there, I should, we can revise just a little bit that this is the classification of expectorants. Okay, this is the entire classification of expectorants. So as we can see here, secretory, stimulant, mucolytic. We have completed the secretory, stimulant, expectorant. We are now on mucolytic expectorant. Okay. So what is the general meaning of expectorant? Expectorant means to expel out. So any drug which is used to expel out the mucus, which increases the volume and fluidity of the secretions of the respiratory tract and help in their easy removal through coughing or ciliary action, is called expectorant. Okay. We have studied secretory expectorant. Now is mucolytic expectorant. So mucolytic expectorant, what it does is viscosity of mucus. Before understanding mucolytic expectorant, so what we need to do is we need to understand why is mucus viscous. So viscosity of mucus of respiratory tract is directly proportional to concentration of mucoproteins in it. So there are some mucoproteins in the mucus which is found in the respiratory tract, and this viscosity is directly proportional to the mucoproteins, concentration of mucoprotein in the mucus. Okay, so what will happen, since these expectorants cause a depolymerization of glycoprotein molecules in the mucus and thus decrease the viscosity of mucus. So this is very easy. Okay, since the concentration or since the viscosity of mucus depends on the concentration of glycoprotein or mucoprotein in it, so what will happen is mucolytic expectorants will decrease the viscosity by causing a depolymerization of this glycoprotein or mucoprotein in the mucus. Okay, thus this will decrease the viscosity of the mucus, and thus this will help in their easy removal. Okay, all right. Now third we will talk about diluent expectorants. So diluent expectorants, these are used in animals and that are dehydrated. Okay, so first of all we need to understand their mechanism of action. So this is a mechanism that is same as secretory expectorant. So we should first revise what was the mechanism of action of secretory expectorant. That was very easy. What happened, there were two methods by which secretory or stimulant expectorant worked, that is direct and indirect. So direct stimulation, that is these secretory or diluent expectorants in this case will act directly by stimulating the tracheobronchial glands, and secondly these secretory or diluent expectorant, these will act by stimulating the vagus nerve, and they will act by stimulating the gastropulmonary vagal reflex, and thus they will be increasing the secretions from the respiratory tract. Okay, so now that is the mechanism of action. Okay, so now before moving ahead, now since we know that we have studied different kinds of expectorants. There are 3 categories and 1 miscellaneous, also 4 categories of expectorants. So why we need a diluent expectorant? This is because in most of the cases in which the animal is suffering from respiratory disease, so in most of those cases there is the condition of dehydration. And there are various reasons why, because why is there the presence of dehydration, or why is the animal dehydrated. So if an animal is suffering from respiratory disease, that animal will be dehydrated in most of the cases because there is less intake of water and there is excessive loss of water. So less intake of water, as you already know, the animal is suffering, animal is in disease condition, there will be less intake of water. But there will be excessive loss of water as well because of pyrexia and hyperpenia. Pyrexia, as you know, is the medical term for fever. Hyperpenia is the increased depth and frequency of breathing. Okay, just to compensate for these water losses and dehydration in animal, we needed diluent expectorants which will perform the function of expectorant as well as they will hydrate the particular animal. Okay,